What's up, people? In Florida, a nurse has been charged in connection to robbing a patient. I'm Chibuzo Wachuku. I'd appreciate you liking this video and subscribing to my channel. This nurse, David Capote, who has worked for the Jackson South Medical Center in Miami-Dade, was arrested and appeared before the judge, where he was charged for fraudulent use of a credit card, exploitation of an elderly person, and fraudulent use of identification. The family of his patient, who needed to be hospitalized for at least 10 days, received alerts of unauthorized transactions totaling up to $760.91. The family also noticed that valuables such as a watch and money were missing. They reported to the police. Using surveillance cameras and cell phone records led to the arrest of Capote, who is also accused of stealing from an employee of that same hospital. I roll the clips now.
Craig, this is so tough. This family was here with a loved one for an extended period of time. So when they started noticing these charges on his card, that's what really hurt them.
Got charged with grand theft, credit card, fraudulent use of credit card, 3 counts.
That's 37-year-old David Capote. Before appearing in court on Wednesday, he was working here for the past year as a clinical staff nurse at Jackson South Medical Center.
Exploitation of the elderly, fraudulent use of identification.
I hope that he, really thinks about what he has done and how he's betrayed the public trust.
Detectives say Capote met Doris Cartagena's dad at the hospital back in May. Doris says her dad had to be admitted for at least 10 days because of blood clots in his lungs. And during that time, his debit card, a watch, and cash missing.
I think it's despicable that he would take advantage of an elderly person and the family when, we as human beings count on them to keep our loved ones safe.
Detectives accuse that nurse of then using the patient's debit card at these 3 businesses, spending nearly $800. The family got alerts about it immediately and reported it.
It's unfortunate, like I said, that you can't feel that you have to even worry about those things when you have a loved one in the hospital. You're already going through so much.
We know Jackson Health System's public safety department worked with Miami-Dade PD on this case. They revealed Nurse David is accused not only of stealing from a patient, but an employee too. In a statement, they say Jackson does not condone any type of criminal acts against anyone in our facilities. The safety of our patients, families, and employees is our top priority.
There were a lot of good nurses that, really took care of him, that showed him love and compassion. So we can't generalize because of one bad apple.
But even with that, this daughter wanted to warn others about what can happen anywhere.
I want to bring awareness to the families that, sometimes we're so worried about, the health issues, but we also need to be aware that they can also fall prey to financial situations.
Officials say that nurse is now on administrative leave pending termination. Live in Southwest Miami-Dade, Maricela.
I am not surprised that a nurse would do that. Nurses, aides, and so on, they are not paid as much as they should be paid. If Capote were making that much money, why would he do that? Before I respond to his actions, I'm going to tell you precautions that should be taken from various angles. Hospitals and nursing homes should consider raising the pay of healthcare workers. Also, the facilities should provide a key to one of the drawers of the nightstands. They should have nightstands with a lock where patients can put their valuables. This country has issues. Healthcare is one of them. Healthcare workers need to be paid more. The government could either mandate facilities to pay their workers more and stop making them work more for less pay, or work the same amount of job for less pay. Either of those things could solve the problem. If you need care in a nursing home, or you need to be hospitalized, you need like a rehab or whatever, I suggest that you either have a money safe and put your valuables in it. If the place where you receive care has a nightstand, as I mentioned earlier, with a lock, put your valuables in there and put your key at the last place that anyone would put his or her hand to get it. Maybe a spot such that you would feel someone trying to take the key. If you feel too weak to make sure nobody will steal your things, then I suggest you get a family member or a friend, preferably one that has a high-paying job or someone that is far away from the urge to get money. If your supposed loved one cannot do anything to avoid losing his or her belongings, you better learn from this incident, because if you dare try to rob that person, I could guarantee you, you will be caught. I advise you to put the valuables of that person in a safe, or put them in the nightstand with a lock and have the key at all times. If you're a patient of a hospital or a resident of a nursing home, or whatever it is, I recommend you have a phone or a laptop so that you can access your bank account and see what is going on. Monitor it so that you will know when something wrong happens to your account. For those of you watching a loved one, I suggest that you try to take permission from that person and monitor his or her account. If you're denied permission, then don't do it. But if you are given permission, then monitor that person's account and make sure that nothing bad happens to it. If anything happens to it, then call the police. The same thing for those of you that are patients. You notice anything in your account that is wrong, call the police. If you're planning to get a career in the healthcare field just to rob patients, then I advise you to forget it. If you actually are interested in a career in healthcare dealing with patients, consider the pay. As for those of you that are already working in the medical field, if you work for a facility and you are not happy with the pay, change careers or work for a healthcare staffing agency or platform. Don't steal from a patient. If you do, you're going to lose your license, registration, certificate, or whatever, and you could do time for it. I hope that David Capote pays for what he did. I hope he does time. I hope the registration or license of Capote is revoked. And I also hope that healthcare centers nationwide take note of this guy so that he does not get any chance to work in the field. Let me know what you think. Thanks for watching.